probably know someone in our lives who has experienced arthritis. Maybe you have a grandmother with really knobby knuckles, or maybe you have an uncle who has difficulty getting up and out of a chair because of the stiffness in their knee. Perhaps you're wondering what you're experiencing. Could it be arthritis? My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and today I'm going to talk about osteoarthritis, what it is, what it might look or feel like in your body, and what you can do about it. Now, there are many types of arthritis. So there are some types that are more inflammatory, infect the whole body system, and often affect the same joint on each side of the body, so the left knee and the right knee at the same time. So this is often diagnosed through a blood test in combination with an x-ray. Now, the more common type of arthritis, the wear and tear type that comes along with aging, is called osteoarthritis, and that's usually diagnosed with an x-ray as well. So we call two bones that come together a joint. So it might be like a knee that is like a hinge joint, might be like a hip that's more like a ball inside a socket, but we also have joints in our spine called facet joints, and they come together, two flat surfaces like this, and they glide, and that's how we move. Now, with all joints, on the surface of that joint is cartilage, and that protects the bone from any wear and tear. The joint itself is also covered by a capsule. Inside, there's a special fluid called synovial fluid, which helps nourish that cartilage. Now, in arthritis, that cartilage breaks down, and so the bone reacts by building up new bone, but it's often irregular and spiky, and it can often decrease the space in that joint. Now, for many of us, we might have that and not even know it. So we might not have any pain or any stiffness. It's often a normal part of aging. But for some people, it can cause more stiffness in the morning. It's harder to get going. You don't move as well. But with time, you start to move a little bit better. Or if it is, in fact, affecting the nerves by either a decrease in the joint space or impacting the space for the disc, then you might also get a bit of pain too. So what can you do about it? Now, there are a few things that we know can help your symptoms. So with regards to the stiffness in the morning, it helps to start off the day with a bit of stretching. I often recommend a hot shower combined with some stretching, and that just speeds up that period of stiffness through the day. We can also help you with that stiffness in our office. So not just people who have arthritis experience spinal stiffness, young people experience it too. So we can help get those joints gliding and moving better so it's not so tight and stiff. It's also important for you to maintain a healthy weight. So of course we know that extra weight can impact the knees and the hips, but just the presence of extra fatty tissue can increase inflammation, which aggravates arthritis. And in turn, we want to keep our blood glucose or our blood sugar levels low, because as that increases, then that causes the cartilage to stiffen and it's more likely to break down. And if you have diabetes, that also causes more inflammation in the area, which is not good for the cartilage. So that brings me to movement. So we know that movement and exercise can help with weight control. We know that it can help with maintaining blood sugar levels. But also, it increases synovial fluid into the joint, so that fluid that the cartilage needs to stay healthy, every time we open and close the joint, new fluid gets kind of pushed in and starts to nourish that joint. So I like to tell people to take a hot shower in the morning, do a bit of stretching, and when you are doing that stretching, think about moving in all planes. So you can either do this sitting or standing or on all fours. And you want to think about moving in flexion, so dropping the chin towards the chest, rounding the spine, rounding the low back if you're in all fours. Extension, so opening the chest, squeezing the shoulder blades, looking up. Twisting or rotation, gazing over the opposite shoulder as you twist. And the other way, both directions. And then side bending, bending the spine into a C shape, letting the head tilt to lengthen the side of the neck, and the opposite way. And you want to do this a few times just to increase the blood flow to the muscles in the area, increase that synovial fluid going into the joints, and decrease that stiffness that you might be feeling because of some arthritis. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.